Now, some people are asking me, doctor, what quantity of alcohol do I need to take which is not going to affect my baby? Like, do I need to stop alcohol completely when planning to get pregnant, or I just need to reduce it and take a low quantity of alcohol before getting pregnant or during pregnancy? This is what we're talking about on this episode. This is Talk Pregnancy with Dr. Noella, bringing to you action on preconception care. We're going to be talking about alcohol. Should you stop alcohol completely, or should you decrease the quantity of alcohol you are taking before getting pregnant and throughout your pregnancy? Don't miss out. Don't forget to subscribe to this channel to get more about preconception. Yes, and the answer to that question is yes, you need to stop alcohol completely when preparing to get pregnant, at least 3 months before getting pregnant. Therefore, you need to plan your pregnancies. You stop 3 months before getting pregnant and throughout your pregnancy. Yes, no alcohol. And when they talk of no alcohol, all forms of alcohol, including wine and beer. Why do you need to stop alcohol? The first thing is, know that once you take alcohol, there are some certain things that you might take. There are some kind of medications you can take that don't cross the placenta. But alcohol, once you take alcohol, it crosses the placenta. So it passes through the umbilical cord of the baby and reaches the baby. So as you are drinking the alcohol, it is reaching the baby too. You know that in some women, like, I don't drink while pregnant, I don't drink, and it's not helpful, it's not good to drink while pregnant. But the women will say, oh no, I drink as I want and I've delivered all my children, they are fine. Please, you need to define that fine. I'm going to tell you why. Now, there are certain things. What would alcohol cause? Alcohol is going to cause miscarriages. So you can see women who just have sometimes early miscarriages, 3 months, 4 months, and 5 months, and you don't see the reason why they are having this, but it is due to that alcohol that they are taking. You will see a woman who delivers a baby who is low birth weight. It is because of that alcohol that they are taking. A woman, they just discovered maybe she was pregnant and the heartbeat of the baby was there. You can go down around 5-6 months, they discover that the baby's heartbeat is no longer there. That's the baby has just died inside. Those are some effects of alcohol. So alcohol is dangerous. You might be having miscarriages and it might not explain that way, but you don't know that it is that alcohol that you were taking while pregnant. And remember that at the early age, the period of first trimester, that's the first 3 months of pregnancy, that's when all organs are being formed. And if you're taking alcohol during that period, those things are being affected. If a heart has to form, if a hand has to form, if this has to form, it might not form well because of that alcohol that you have taken at that moment. So it starts right at preconception period. That's 3 months before you get pregnant. You stop taking alcohol. So in a long term, when you take this alcohol, that's why I'm saying that people, they might be thinking that their child is fine. Yes, they have delivered the baby, yet at that moment the baby has cried, but the baby has to still grow. The brain was forming during that time that you were pregnant and taking that alcohol. So it causes a long-term effect, which is called fetal alcohol spectrum disorders. These fetal alcohol spectrum disorders contains a list of many behavioral changes, which is going to affect the child's behavior, the child's intellectual capacity, the physical ability. So those kind of things, these all comprise it in the fetal alcohol spectrum disorders. So you can see a child, they have a kind of nose, a characteristic kind of face, where they're having like flat face, a flat nose. That's what they call fetal alcohol syndrome faces. So you see the kind of faces that they have. There's a particular characteristics of children who are born with women who have been drinking a lot of alcohol. It can also lead to decreased IQ, that's the intellectual quotient. So you see a baby who is born with a small size of head. The head is smaller than the age of the baby. See that they have low birth weight. They grow up to have poor communication. They are not studying well in school. They have difficulties in attention. To concentrate in one thing, they cannot concentrate. They have learning disabilities. You might be seeing your child, the child is going to schools trying to study this, everybody is picking up something at that age, but the child is very slow, the child is not picking up, and you might never ever, you might just think that this child is, let me say in quotes, like a dull child, but you might never ever attribute it to that alcohol that you were taking. So it has a long-term effect, and when that long-term effect is reaching, you might never think that it was that alcohol that caused it, because this child is going to have low IQ, intellectual disabilities, attention deficit. The child will not be able to concentrate for long, poor communication skills. So those things affect children in a long run. So when we say don't drink alcohol and you drink, you think that the only thing about children is just to deliver and they cry at that moment. No, you're thinking about the future of that baby, the long-term disability that it can cause to this child. So the Center of Disease Control has advised that no alcohol during pregnancy. And just recently, the American College of Obstetrics and Gynecologists have been going and sensitizing the population on various things, and just recently they posted something that no alcohol, zero alcohol during pregnancy. Now wherever you are, if you're pregnant, it's also okay, you can stop taking alcohol wherever you are. Why? Because the brain still develops throughout pregnancy. So wherever you have heard this and you are pregnant, stop taking the alcohol, such that the remaining part of the brain development during pregnancy is going to be fine. So please, it's never too late to stop taking that alcohol during pregnancy. Please, please, please. And this is Action on Preconception Care we are bringing to you through Talk Pregnancy with Dr. Noella. So if you want to have a consultation with us, therefore we have people who have been trained on preconception care. You can click on the link below and get to us, and you book for your consultations. You're going to have a full package of preconception care. What are the other things you need to do during preconception care? I made a video on the importance of folic acid before getting pregnant, and the full list of what you need to do before getting pregnant. So after this video, you can go ahead and watch that video so that you have a complete knowledge on what you need to do before getting pregnant, please. And during our sessions with you, during our consultations, at the end, we're going to give you a checklist where you're going to use, and we're going to discuss all about that checklist to be sure that you are ready and safe for pregnancy, in order to promote a healthy mother, healthy baby, and a healthy family, in a long run, a healthy community. Thank you very much for watching, and don't forget to click on that subscription button. Share widely to all people out there. Thank you very much, and God bless you.